Hospitals are seeing a surge in respiratory illnesses. Now, some of them are bringing back mask policies. Nationwide, the CDC says flu cases went up to 16% the week before Christmas. More than half of the country is reporting high or very high levels of COVID, flu, and RSV. So far, only 6 states are requiring patients to wear masks to stop the spread. California is one of them, and the CDC warning now that the worst of the respiratory illness season is yet to come. This morning, we welcome Dr. Vanessa Walker. She's with Sutter Health. Dr. Walker, always good to see you. Let's just dive right in. Should we be expecting a wider scale shift back to this mandatory masking?
I don't know that I can comment on what we're going to end up seeing from, different health officials or government agencies. I do know that as a practicing physician, I am wearing a mask anytime I'm entering the hospital or taking care of patients. I don't want to get them sick if I'm carrying something that I don't know about, and I don't want them to get me sick and pass it to my family. So if you're going to be in any situation where you're going to be under with a lot of people and out and about, you probably should be masking up just to protect yourself.
And any idea at this point what may be contributing to this surge that we're seeing now?
As we've been seeing over the past few years, this is really probably one of the first years where everybody is coming out completely unmasked and trying to kind of get back to their normal. Also, I think that we're not seeing as many people taking vaccines as we had seen previously. And that will absolutely contribute to the number of cases we're seeing, as well as the number of hospitalizations we're seeing. I think, fortunately, we still have time. We are heading into a peak. We have not peaked yet. We will, I think, see more and more people come down with influenza, RSV, and COVID. But you can still get vaccinated against 2 of them for the majority of adults and children. And in fact, you can get vaccinated against RSV if you're elderly or if you are pregnant in your 3rd trimester. So lots of ways to protect ourselves.
And speaking of those vaccines, I think, to your point, a lot of people got those vaccines pretty early on. Is it still important for people to still be getting those boosters too?
Yeah, if you're eligible for any booster and you're in that time frame, absolutely, it's a time to take it. If you haven't, a lot of people, forgot or didn't take the flu vaccine and think, oh, well, it's too late. It's not too late. We are going to see this flu season continue on. There's no reason why you shouldn't get your flu vaccine now if you haven't already had it. It can protect you. We see a good match, as we've seen in the past couple of years, against the influenza. It's influenza A is a predominant virus that we're seeing, and we've got a really good match to it. So I think it may not prevent you from getting the flu, but it will most likely prevent you from getting hospitalized or having a really bad outcome.
So, Dr. Walker, we have about a minute left. 2 things I want you to cover here for people who don't know. Explain the difference between COVID, the flu, and RSV, and ultimately what should people be doing now to keep themselves safe?
So these are 3 respiratory viruses that can present themselves in very similar ways. Typical cold symptoms, cough, sneezing, runny nose, sore throats, fevers, chills, body aches, very similar. And then they can all cause similar severe symptoms like shortness of breath, difficulty breathing, low oxygen levels, things like that. So really, it comes down to getting tested to know exactly what it is that you have. But I would only probably get tested if you are somebody in a group that needs to get treated. So if you're a young, healthy person, you probably don't need to get tested. But if you're elderly, have multiple comorbidities, heart disease, lung disease, cancer, things like that, then you should get tested so that we can get you treated for either influenza or COVID. There is no treatment for RSV, just supportive care. For our little ones, it's RSV and influenza are the ones that we're really concerned about. So if they're looking sick, they're not feeling well, they're lethargic, they're having a hard time breathing, I would absolutely get them tested and get them looked at by their pediatrician or an emergency department if they're looking poorly, because they need more support. But really, it's just being, trying to be cautious, drinking lots of fluids, staying away from people, washing your hands, that kind of stuff is how to prevent getting sick.
Yeah, and wearing the mask, of course, when you're in those settings, like you said in the beginning, when you're in those settings that you could potentially get sick. Dr. Walker, always good to see you. Thanks so much for joining us this morning. We appreciate it.